Hi, my name is Tianyu She. I'm a fourth-year medical student at the New York Institute of Technology, and you're listening to Do or Do Not. On today's episode, we have Dr. Qiuping Zhou. Dr. Zhou is a board-certified attending physician specialized in emergency medicine and critical care medicine at North Shore University Hospital and Long Island Jewish Medical Center. She is the director of the Cardiothoracic Intensive Care Unit and an assistant professor at the Zucker School of Medicine. She earned her medical degree at NYIT, but not before first becoming a physician in China and nurse practitioner here in the United States. She completed her residency and fellowship in critical care at North Shore University Hospital. We hope this interview gives you insight into a foreign graduate route.
All right, Qiuping, thank you so much for being with us today.
Thanks for the opportunity, Ian. Thank you for having me.
Yeah, I'm so excited to talk to you today. Just thinking about how we would start, there's so many ways to start this interview, but I think maybe you just start by telling us about what it's like working in a cardiothoracic ICU and what your position is and what a normal day would look like for you.
Sure. I am the director of the Cardiothoracic ICU at Long Island Jewish Medical Center currently. I transitioned myself to this role and this position about 2 years ago. Before that, I was 50% of emergency medicine and 50% of cardiothoracic ICU. It's a 50-50 type of split, which is not uncommon for the EM and critical care physicians. And made that transition 2 years ago. And soon after the transition, I accepted the position as a director of the cardiothoracic ICU at LIJ. So my day usually starts that I go to the unit around 7:45. We will start our morning report with the surgeons, with ACPs, and our nursing leadership. It's a multidisciplinary approach for the morning report. And during the morning report, we'll go over all the patients in the unit and what the care and the plan for the day will be discussed. And that will be carried out during runs and during the day. So I usually start my rounding around 9 o'clock in the morning. And with a multidisciplinary team with nursing leadership, the primary care nurse, sometimes my ACP or resident, sometimes the pharmacist and the physical therapist, social worker, case management, and nutritionist will join us for the rounding. And it takes about 2 or 3 hours. Sometimes it carries into the early afternoon. After rounding, that's when the cases are starting coming out of the OR. We need to prepare to take care of those immediate post-op patients for the CTICU. During that time, I also perform all the procedures. What needs to be done, the imaging studies. Then I will also have some meetings discussing with other units and the nursing staff. And the day is busy. Usually, before you know it, it's 7 o'clock.
That's a long day. And just for the listeners, and maybe just a question for you, you're making this sound like this is an easy job that just takes a long time, but this is a difficult job with very critical patients, and they're all cardiothoracic patients, and the cardiothoracic surgeons are kind of a tough crew. Is all of that true?
You bet. We know across the board, the cardiothoracic surgeons are a tough crew to work with. I understand that. They are in the operating room. They are putting those hearts into rest. It takes tremendous amount of training and meticulous work to get those patients out of the OR in a condition that requires the post-op care to be the best, nothing less the best. So we work very well with them. I'm very lucky to have a group of surgeons that are very compassionate about their patient care. And we have a common goal. And whatever the best outcome for our patients, we will do it together.
Yeah, that's amazing. Amazing. Tough job. So let me ask you, Qiuping. Now, again, as I said earlier, like your story is so rich. But can you start by telling us a little bit about being born in China and when you decided you wanted to be a doctor, and then maybe a little bit about your journey to the U.S.?
Sure. That was a long way. I actually was born and raised in China, came to the States in my early 20s. So a little bit of background about the education in China, I think it's worthwhile to mention. In 1977, China reinstated its college entrance exam after about a gap of more than a decade when China was plugged into the Cultural Revolution. At that point, the early 80s, only the top 5% of high school graduates can go into a college. And I was very fortunate to be that 5% of high school graduates to get into medical school. The medical education in China is quite different from the States, from the Western medical education. We go from high school directly into medical school. It's a 5 years education. And after that, you don't have residency training program. You go into the hospitals and be mentored by the specialist in the specialty you choose or you're assigned to at that time. So I came to the States after I graduated from medical school with a very limited language capacity. I was barely speaking English. So I joined my husband. He was doing his graduate studies in the States. And I decided to go into nursing for many, many reasons. And transferred all my credits and earned my degree and become RN first. So my first job was an ER nurse at Bloomington Hospital in Indiana. And soon after that, I came to New York State. I became an RN at North Shore University Hospital in the emergency room.
That's kind of an interesting part for me because I actually was a medical student at North Shore at the time. And I remember meeting you in the ER. I did not know that you were an MD at that point, obviously. And I think that as a medical student, what I remember is you just taking very good care of patients and being very nice to me. So I guess my question is, you already have a full medical education and now you're working as a nurse. Was that difficult for you to do? How did you feel being a nurse that was trained as an MD in the past?
It actually a very raw transitioning. I was actually just a fresh graduate medical school from China. So for me, becoming a nurse was an opportunity. And also there was so much for me to learn the healthcare in the States. And I really valued it as a great opportunity for me to grow. So that kind of gratitude just granted me to start my career from the bottom and learn as much as I can. And believe me, I learned so much from my colleagues, the nurses, and my attendings, my residents at that time. It was a great, great learning stage.
Just as an aside, in preparation for this interview, I was actually in the ER today, and I asked a few of the nurses that have been there for a long time about you, and they all said,
"You did?"
Yeah, I did. Just general. I didn't tell them we were doing an interview, but I said, What do you think of Qiuping? And they said, oh, she's an attending. She has always been so nice to us. So that's obviously true. That's not anything that is deep or that I'm surprised about. But my question is, do you think that having been a nurse, again, as an aside, we had someone recently on the podcast and we asked them what advice they would give. And they said, be nice to the nurses. First of all, I assume you would agree with that advice. But do you think being a nurse gives you a different perspective on nursing?
Absolutely. I agree wholeheartedly. And actually, one of my tips in teaching the residents during my career in the emergency department is you need to learn from the nurses and be very good to the nurses. They have so much to offer. Coming out of medical school, you really know very little about medicine. You learn all that from the books, and you know a lot of Krebs cycle, or this biochemistry and pharmacology. But how does it apply to the patients and the nurses knows from their clinical experience? And that's very valuable. So I agree, totally agree, that you need to win the nurses' heart and be good to the nurses, and they can be your best friends and can save you when in big times.
That's great. So Qiuping, you went to medical school in China, you came to the United States, you became a nurse, you're in the ER. When did you decide that you wanted to do something more than be an ER nurse?
While I was working in the cath lab, I remember as RN and a charge nurse. And I learned the opportunity to become a nurse practitioner to get my master's degree and to advance myself to the next step, which North Shore was fully supportive, and so does my colleagues. So I applied and I was accepted to CW Post that had a 2 to 3 year program. You can take the classes as a part-time student, which worked very well for me because at that time I have a young family, have 2 young children, and I also have to work full-time in order to support the family. We have a house, we have 2 cars, we have 2 young children. So I was working full-time and taking evening classes. It took me 3 years to complete my NP degree. Soon after that, I became a nurse practitioner at the Cardiothoracic ICU in North Shore.
So now you've done 3 different schools and you become a nurse practitioner.
I know, that's a disaster, isn't it?
Unbelievable. That's a lot of school, right?
Right, and I'm not done there yet.
Yeah, we're not done with the story yet. I'm already tired. All right, so you're working in the unit, and at some point, when or how did you decide that you wanted to become a doctor?
I think it was, ironically, when I was driving to CW Post, that's in Old Brookville. The campus is right next to NYIT, where the NICOM campus is. Every day I'm driving there to go to school, and I see the NICOM sign at the side of the road. And one day, I was just, of course, I looked into it as a medical school, as a dual program, and I was MD from China, and let me look into that. So I made a right turn into the campus one day during my NP education. I went to the building, I remember, and I walked into the administration office and was just inquiring out of curiosity what the requirement to get into a medical school like this. I had no idea when I walked in. And I came out, was so excited. I still remember to this day that I walked into the office, administrative office, with no clue and no knowledge of what it was about. And I walked out knowing that they have accelerated, I think it's called a accelerated foreign graduate program that was designed for foreign graduates, that you can be there and be in the same classroom, getting the similar basic science education with the dual students, but they are going to shorten the education by 3 years instead of 4 years of medical school. So I only needed to be 3 years in the medical school. I was just so excited to find out there was a program that almost perfect fits my background. And I started dreaming about it and thinking about it. And it was a hard decision. Remember that I have 2 young kids.
Right.
And I have financially going back to medical school for the second time was a big decision. And I talked to my family, my husband, and it took us a long time to make a decision. So I'm going to do it.
That's
and
amazing.
I did.
That's amazing. Yeah. So now, so you didn't apply to any other programs. You just applied to the New York Osteopathic School. Is that right?
The only program. And at that time, I remember when I decided to start applying, going back to medical school, I started talking to my surgeons and my intensivists in this cardiothoracic ICU. And a lot of suggestions and help came from them. Like, look, you can apply to you have a family here, we understand. You can apply to Stony Brook, and you can apply to medical schools in the city, like downstate, NYU, all the medical schools in there, we will support you. But in back of my mind, I said, this is a program that's perfect design for me, and I'm going to go after this program only. And I did.
Now, how did you feel about the DO degree? You know, you were an MD in China, and now you're going to be a DO. Is there any issue with that? And did you have a lot of experience with DOs in the hospital prior to that?
Oh, yes. I had quite a bit of experience with some of the phenomenal and great DO physicians at North Shore at that time, Simon Prince, and also I had 2 physicians, I think Matt Nelson, also Mike Casera, were the 2 DO attendings in the emergency department at that time. They were really inspirations for me.
That's awesome. So you went to medical school at NICOM and you were still working, I guess, as a nurse practitioner. How was your experience at NICOM? How do you remember the workload and how was working while you're doing this?
The experience at NICOM was great. I remember that going to the classroom every morning, sitting in the giant auditorium was very exciting for me. Working at the same time, full-time. Yeah, I was a full-time mother and full-time nurse practitioner and going to medical school full-time. Crazy, right?
Yeah, I don't know how you had enough hours in a day to do that. That is totally unbelievable. Amazing.
Basically, it's 365 days. I probably worked 360 days out of the 365 for years. I know, it was crazy. And my North Shore leadership and my colleagues were so supportive. They were like adjusting the schedule. I work on the nights and let's say 16 hours, 8 hours sometimes during the night. And weekends, I would do a 24-hour shift as a nurse practitioner. Goes in the morning, 6, 7 o'clock, and then leave the ICU 8 o'clock in the morning and go home, sleep a little on a Sunday and go back to school Monday. So it was a tough time. I don't know how I did it. Looking back, I'm like, oh, was I crazy to do this?
Yeah, I just think it sounds like there is no question I could not have done that. I don't think 99.999% of people on the planet, I don't think anybody on the planet other than you could have done that.
Trust me, I don't recommend that. And looking back, I'm like, how did I do this?
Yeah. Crazy. Yeah, that would not be a piece of advice that I would give. Work as a full-time nurse practitioner, raise a family, and go to medical school. That sounds like 17 jobs. Yeah. That's
no.
So now you decide you finished NICOM unbelievably, did all of this at one time, and then you had to decide on a residency, and you obviously had experience in cardiothoracic, you had experience in the ICU, you had experience with the ER. How did you decide what you wanted to do as far as specialty, and how did you decide on where you were going to apply for training?
So I was working with the cardiothoracic surgeons, the intensivist, and the cardiothoracic ICU is probably the sickest in any hospital. Patients are really sick on a lot of cardiac support, drips, inotropics, pressors, and procedures. I remember the training as a nurse practitioner in the cardiothoracic ICU really prepared me well. At that time, we have 22-bed ICU was running basically a single coverage with ACP. And we do all the procedures in the unit. We were putting chest tubes in, putting pacing wires in, and putting swan in. At that time, in the early 2000, we put a lot of swans in the patient. Every patient come out of the OR with the swan. So that prepared me very well. I'm very passionate and very drawn to the procedure-related specialty. Emergency medicine was, being an ER nurse also, emergency medicine with the natural fits me perfectly. So with not much of thinking, I decided to apply for emergency medicine.
Now, you had to apply, obviously, for your residency. Was it difficult to decide where to go? And do you think being a DO influenced where you chose or what your options were?
Not really. Ironically, I applied to one single medical school. And when it comes to the residency application, I only applied to 2 programs. So it's
you're
funny.
Pretty confident. Yeah, and you knew what you wanted, obviously.
Yes, I applied to Stony Brook and also North Shore. Those are the 2 programs I applied to. I was limiting myself to a 3-year program. LIJ was a 4-year EM residency program at that time. So both Stony Brook and North Shore was 3 years programs. So I decided to apply to those 2. My interviews were very well. I think I got both programs or expressed interest in my application. And I decided to sign out of match at North Shore.
Okay, so very linear path. Everything worked out. That part of the story is great. One of the things that I always respect most about you is that you've done all of these things, and now you're a resident. You went to medical school twice You went to nursing school, you went to nurse practitioner school, and now you're working alongside of residents that have no experience and just came out of medical school. And maybe you even know more than some of the attendings that you're working with, but you were always so humble and nice. Was that difficult for you?
No, not really. I always feel that my experience did help me, and it's already helped me get into the residency program I dreamed of. It was very competitive at that time for a DO student to get into a competitive EM program. And my attendings, my co-residents were amazing. They had so much to offer. I just very humbled by how smart, how intelligent they were. For example, let's just say name Matt Nelson. I'm going to mention his name. He was just a great inspiration and mentor for me during my early stage of training at North Shore. I met him when I was a NP and again, medical student, again, resident. He was the fellow when I started residency training. He was the ultrasound fellow. So technically, he was my attending. He is extremely smart and fast and efficient. He was my idol. I just wanted to be like him. So when we worked together, we had a secret competition. So he's so fast, he will see the patient before anybody can get to the patient. He'll start writing orders. So my secret competition with him was like, I'm going to get the chart before he pick up from the chart rack. I'm going to see the patient before him. I'm going to start writing orders before him, before he get to write. And I am going to get the chest the x-ray. At that time, we were still having, it's non-digital. It's all hard copies x-ray. I have to walk all the way to radiology department to find my patient's x-ray hard copy and bring back to the ER and to show it to him. So I always wanted to see the x-ray before Matt sees the x-ray. He doesn't know any of that.
Right.
I never told him about that. So that's how I really respected and learned from even though he was a lot of residents and junior attendings, I feel they have so much to offer to teach me, and I'm just learning so much from them.
I think your attitude always has been amazing. I agree that Matt Nelson is amazing. No question, just such a great role model. He was probably younger than you at that point. Is that right?
He was.
That never bothered you, or the fact that you had done all this time as a nurse practitioner, you just wanted to learn from Matt and he was good and you respected that, right?
Absolutely. Not only the attending staff, even the nursing staff. I was a nurse in the ER. Coming back as a physician, the transition I was concerned about it. But they welcomed me and they worked with me with full respect up to this date. I really love my ER nursing staff, give me all the training, all the learning I needed, and it really nurtured me and supported me through my past.
I have chills listening to the whole story, Qiuping. But
yeah,
it's so good.
It was a disaster, I know.
No, you're a good person. You just are amazing. But did you know that you wanted to stay at North Shore? Was that the plan the whole time, or did that just kind of work itself out? And then how did you end up doing critical care?
I always loved working North Shore. I feel that starting as a staff RN and growing into all different roles with all the support and schooling from North Shore was priceless, was really precious. So I never thought of leaving North Shore. So after graduating from my EM training as an EM physician, and I wanted to stay. But honestly, at that time, the leadership wasn't hiring physicians without fellowship training. And also, I always loved critical care. I did 4 years of cardiothoracic ICU as NP. So I applied for the critical care fellowship during my residency training towards the end of the third year, senior year. Again, I feel like I was the natural transitioning into what I'm really passionate about. I love critical care. I'm just so glad I did it, looking back.
Qiuping, I'm going to switch gears a little bit and ask you a couple of questions that may be a little personal. The first one is, and again, I like going back to some of the things that people on prior podcasts have said and kind of bringing them forward. So we had an awesome female anesthesiologist. You know, she made a statement like, you can't do everything perfectly. And you were again, and she did, she worked really hard, and I think I've worked really hard, but I don't think either of us have done half of what you did at the time of your residency. So you were a wife, a mom, a practicing full-time nurse practitioner, and a medical student. How difficult was it to balance all of those things?
It was very difficult, and be honest with you. And did I do everything perfectly? I don't think so. Looking back, I often question myself about what I was all in. I was putting all the effort, all the focus on my career and my passion about medicine. So I often had this guilt that's always with me for years, that should I have spent more time or more balance in my personal life with my family? And it was so funny. During the early training, there was a joke, inside joke in my family. One day I had a conversation with my son who was in grade school. And I was like, so, Andrew, how was Miss So-and-so your teacher? And my son's answer was, Mom, that was my last year's teacher.
All right.
And I remember that to this day. It got me.
Oh, no.
So I was like, wow, I was not there. And what if my children are not getting the attention that they needed as the young children from their mother? And my husband was extremely supportive. He understood when I made a decision to go all the way in. He knew there's nothing can pull me back. So he really gave all his 100% support to the family. But still, at that young age, I feel there's not only just I'm missing a lot of the PTA meetings or this and that, their performances. I tried, but what's missing is missing. Even up to this date, I often ask my children, I said, so Mom was not there when you needed me the most, when you were young. So I do have the skill. What do you guys think? And for both of them, now I'm going to tell you a little bit of my children. For both of them, the answer was just so amazing that they both told me, like, Mom, what you did was setting the standard, the role model for us. We know how hard you worked, and we know we need to do everything to help you at that age. So with after-school programs, they will find their friends carpooling home before my husband gets home from work. They just learn to be so self-sufficient and so independent. And that, in the long run, I think it's a positive thing came out the situations at that time. I don't know if that makes sense to you.
No, it totally makes sense.
They became so independent and self-sufficient. And they know success comes from hard working.
Yeah, Qiuping, I agree with that 100%. And, just to echo in my own life, I feel like I've dedicated a lot of my life to medicine, and I really love my job and I love my career. And sometimes, exactly like you, I feel a little bit sad that maybe I can't spend as much time or do as much as some other parents can. But I think I take solace in the fact that, exactly like you, I have good children, thankfully. And I think that part of the teaching, as you're saying, comes from you setting the example and them saying, listen, Mom is doing all of these things for her family and to help her patients. And I want to be like Mom when I grow up. And although maybe you're not teaching as much directly, you're teaching through your example. Do you think that's right?
I totally agree. And turned out my son became a physician. He's a surgeon, a urologist in training right now. So really becoming a physician didn't scare away from him pursuing his dream. It's rewarding.
Just to comment on that too, Qiuping, I want my kids, as I'm sure you do, just to be happy, and to pick a career that's going to be fulfilling to them and make them happy. I don't necessarily want them to be doctors, but it always makes me sad when strong doctors tell me that they would never let their kids go into medicine, because I love my profession. I'm sure you do too. Obviously, from the story, there's no question you do. So it makes me feel warm and fuzzy when I hear my doctor friends tell me that their kids went into medicine and they're proud of them.
Yeah, I'm very proud of my children. And before he made a decision to become a physician, I actually took him to the hospital. I did not voice my opinion strongly. And I love my profession. I love being a physician. I love emergency medicine and critical care. I will do it again if I have to choose my career. So he saw that. He went to the ER. He worked by my side. He saw how the ER operates and what the patient population were. So he saw it. He saw that side of medicine, and he still decided to become a physician.
That's great. Amazing. So Qiuping, so again, one more little personal question. Obviously, you went through all this education. Did you take loans for some of your education? And did that bother you, or you think that's affected you? What are your opinion on loans for medical school?
I did not take loans because, as I said earlier, I worked full-time. I was able to pay off my tuition, and I lived at home at that time. So that was actually a decision that for me, going back to medical school was a significant endeavor for me and for my family. So I did not really want to put this financial burden onto my family. We have a house, have a mortgage, has cars, and the children's education. So that's, I think, one of the reasons I stayed on as a full-time nurse practitioner while I was in medical school. So I was lucky that I did not take a loan.
Yeah, I don't know if that was lucky. You were the bank. You were basically, right? You didn't need the bank because you were the bank. That's amazing. Thank you so much for being with us. This interview is just inspiring and amazing. But Qiuping, usually the last question I ask is, I think most people have some advice that they were given throughout their career, whether it be from college or from nursing or an attending that you had, or from your residency or medical school. You had a lot of education, but can you think of one piece of advice, or even a few pieces of advice that you were given as you went through your training that you think is valuable to share with people listening to the podcast?
Oh, sure. I think when I was working towards my NP degree and thinking about going back to medical school, the decision was a big decision. I just wasn't sure if I was doing the right thing. Should I just be the nurse practitioner and taking care of the family, have a steady salary, or should I go forward with the medical school? I was accepted already. And I spoke with one of the cardiothoracic surgeons at that time. That was the best advice he gave it to me. He said that you just need to own your career and stick to your dream, which I did, by going back to medical school.
Question. Amen.
By going back to the school the second time to and did all that. So own your career and stick to it. At times it may not seem to be possible, but the possibility comes from your drive. You stick to it and owning it, and you'll get to where you want it to be.
Qiuping, amazing advice, amazing interview. Yeah. Thank you for your time. I can't thank you enough. This has been just a great interview. I really appreciate your time.
Thank you for having me, Ian. I really appreciate the opportunity.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there's someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tianyu Shea. Thank you guys so much for listening to Do or Do Not.